62-year-old Brenda Andrews loves hiking, biking, and skiing, but since January of last year, she can barely walk. Andrews has severe arthritis in both knees.
I was in a lot of pain, and that's when I got put on the wait list.
A wait list for knee replacement surgery. 15 months later, she's still waiting. Andrews says she has spent thousands of dollars on physiotherapy and medication and lives in pain every day.
I was told to walk and bike that knees-like motion, but boy, there are times it's tooth gritting to make sure to do that activity.
According to the Canadian Institute for Health Information, the wait time for knee or hip replacements should be within 6 months. But from April 2020 to September 2021, only 30% of Saskatchewan patients waiting for a new knee had the surgery within that time frame. And for hip replacements, 43% of people had the surgery within 6 months, the worst record in Canada. Today, the official opposition had pointed words for the health minister, noting this report doesn't use data from the fourth wave of COVID, which devastated Saskatchewan's health system.
By any measure that matters, this minister was already, before the pandemic, the worst health minister in the entire country.
The surgical wait list has grown during the pandemic, with COVID-19 taking up much needed resources. Today, there are still between 34 and 35,000 people waiting for surgery. But the health minister says overall surgical capacity is improving, operating at nearly 100% capacity, with some communities even exceeding their scheduled surgeries.
We're only 200 surgeries away from meeting our 2019 targets, Mr. Speaker, but we're on track to be able to meet those targets and exceed them to be able to get our surgical capacity up to 97,000.
For Brenda Andrews, she's been told by doctors it'll be at least 9 more months until she can get her surgery. Yasmin Ranea, CBC News, Saskatoon.